Movember is back with mustaches and a mission, saving lives by changing the way we think about men's health. This year, the Movember Institute of Men's Health's comprehensive new Real Face of Men's Health report takes that mission even further. And joining us now with more insight is senior researcher at the Movember Research Institute, Brian Hellman. Good morning, Brian. How you doing?
Good morning, Mariah. Thanks. I'm doing great. Yeah, thanks for the opportunity to be here.
Absolutely. We are happy to have you talking about men's health. We know sometimes men, they can shy away from going to the doctor or making their health a priority. So I, for one, am happy that you are here shedding some light on this. The new report calls men's health a family and community issue. Indeed, it is not just a men's issue. Why is that so important to make that distinction?
Thank you, Mariah. Yeah, and we titled our report The Real Face of Men's Health because we wanted to emphasize that the real face is not just a solitary man in the doctor's office. If we just think of any of our relationships with our loved ones, men or women, when they're doing well and thriving, it ripple effect connects to us, and we feel happy for them and proud for them. Or if we know that a loved one is struggling with a health issue, or God forbid, if we lose them too early, it really affects all of us as well. And so that's the ripple effect that we try to emphasize in this report.
Indeed, and because men, they also need that support system too. They are the strong ones of the family, but they also need that support system to make sure that they're holding themselves accountable.
Totally.
Absolutely. So why are men in the U.S. dying younger than men in other wealthy countries? And what do you think is driving that gap?
Yeah, I mean, and let's dig into some of the key numbers. I mean, the key one to emphasize is that we found that 53% of men who died last year in the United States died under the age of 75, which is kind of a threshold internationally for what's called premature mortality. So fully a majority of men die prematurely in the United States. And we just don't see that in other wealthy industrialized countries. In fact, when you compare the US against the country where men are living the longest, there's a 6-year gap. And that's comparing men to men, leaving aside any, easy presumption biologically about men versus women. And look, there's a reason the report is as thick as it is. There are a lot of complex factors underlying why that is happening here in the US. So we dig into those geographic trends and demographic trends. But we also just like to emphasize a couple of key things, that you need to have access to high quality health care near you. And not every community in the United States has that, and it has impacts on men's lives and on all of us. And we also need to, as you're alluding to, continue to break down those stigmas that might be keeping guys from feeling comfortable seeking help.
Yes, and I know we want to do everything that we can in those areas to bring that number down, or of course shrink that gap. Such a big shock there. And when we think about men's health, it's often framed as a personal issue, like we said before, but your report shows that there's a massive economic impact from these health disparities as well. And can you elaborate on how big that burden is and what's driving it?
Well, you think of the cost of hospital visits, of insurance, of, when a man dies too early, the loss of productivity and income to his workplace, to his family. This is all the implications in addition to the real human toll of losing guys too early. We analyzed only 5 leading causes of men's premature mortality financially and found that the total toll of all those factors was $420 billion, which is one of these mind-boggling numbers. When you crunch it down, that would be the equivalent of being able to run 1,500 new hospitals across the United States for a year. That's how much only from these 5 leading causes of premature mortality. So the impacts from the human side, the family side, the economic side are really impossible to ignore.
Yes, definitely an umbrella effect here. And how do cultural ideas about masculinity keep men from seeking care? Like we said, they want to be strong. They want to be like, oh, no, I can handle it. It's not that big of a deal. But, what can we do to change that?
Yeah, and it's really like the experience of a man interacting with those stigmas and those notions is a complex one. I mean, there's still the idea out there alive in society, the stereotype that, okay, men should be tough, rub dirt on it, walk it off, don't seek help. But if you talk to individual guys, they will tell you 2 things. One, that they are very aware of that notion and that idea in society, but also far fewer of them say that that's actually their own personal value that they hold on to. Guys in our survey were going to the doctor from their own volition. They said that looking after their health was a sign of self-respect, and there's often this gap or this distance between the big, notion in society of what masculinity means versus guys' own, values. And so we need to continue to break down those barriers.
Yeah, and not only that, we know that behind every man's health story is often a caregiver. Usually it could be a woman, a spouse, or sometimes their mother. They have to push them out there too. So what do we need to understand about their sacrifices and struggles?
Yeah. We talked to 2,000 caregivers for men in this study, women as well as men, and their stories are rich and complex. I mean, on the one hand, it's the clearest space where we see that link because these caregivers themselves are reporting mental health challenges from being a caregiver, financial challenges from being a caregiver, restrictions on their own social life and well-being from being a caregiver. But they also talk about how it brings a closer bond of connection and that it brings them closer to that man in their life. So this is another essential part of the real face of men's health.
Shout out to all of the caregivers out there. Thank you
Totally.
so much. Now, the important thing is we're not just talking about physical health, but mental health plays a huge deal in this. And mental health and loneliness are big topics in your report. Why are men struggling more than ever, and what can be done about that?
I mean, you can't look at men's health without seeing the trends related to suicide. Men are almost 4 times as likely to die by suicide. And we see that a lot of men who die by suicide within the past year had actually sought some kind of mental health treatment, but yet these guys are slipping through the cracks somehow. So we need to do better by them. And on the loneliness side, I feel like it's kind of a modern day trend in our society, isn't it? As more of our lives move online, we're still kind of adjusting back from this disruption of the COVID lockdown period and getting back socially connected with one another. It's just, and men and women alike are feeling lonely in the United States. It's just that men, I think the surveys show, are just less likely to admit to that, to reach out, to have those close sources of support. We've seen such a big decrease in the amount of men who say they have close friends.
Yeah.
And that's, something that, as a guy, hits me in the heart, really.
Yes, and even when they have those close friends, sometimes it's hard to open up to them as well because you don't want to get that judgment back. So I certainly understand what you mean. We've talked about so much, but the good news here is that Movember is all about action. So for our viewers who are out there watching today, what's one simple thing that they can do right now to support men's health?
Well, we're talking about stigmas. We're talking about how hard it is to have these conversations. Movember exists as a strategy to make these conversations easier to have. The original idea was to ask guys to grow a mustache for the month of November, because if you don't usually wear a mustache and all of a sudden you do, your friends are going to talk to you about it or ask you about it. And all of a sudden then you can talk that hey, look, I care about these issues of men's health, suicide prevention, prostate cancer awareness, other things. And so head to Movember.com, learn more about how that works, access the report, and access tools that you can use to help you in having conversations with people close to you.
Absolutely. Look, even if you're out there and you already have a mustache, shave it clean and start over. Use the month of November to spread awareness and support the men around you and in your community. Cannot thank you enough for tuning in with us this morning. We really appreciate that.
Thank you, Mariah.
Everybody at home, we've got those links for you on our As Seen on Day to Day page. Brian, come back anytime. We'd be happy to have you.